I'm Dr. Jonathan Hancock. I came here from Columbus, Ohio, where I was training. Coming out of training, I love to do pretty much everything in orthopedics. I'm essentially a general orthopedist, so I take care of all the fracture work. I enjoy that a lot. I had a large amount of trauma training. I'm also a sports enthusiast, so I love to play sports, love to be active. And in such, I love to take care of athletes because I can relate with them in their many injuries as well as in their desire to maintain their activity. So I try to get them back to being active as soon as possible and keeping them healthy as they're going throughout their different events and activities. I took care of a nice lady who had a bone disease that made her bone being more brittle, called Paget's disease. And before the surgery, we talked about the possible risks and complications of doing that type of a surgery, and that she'd be more likely to fracture in her pelvis where she had that bone disease. Because I've been trained well in trauma and other aspects of total joint replacement, I was able to put screws into her ilium and pubis as well as into her ischium, which provides stability. And then I was able to finish and complete the total hip arthroplasty so that we can get her moving as soon as possible and help give her the best opportunity to recover and be active and independent. Typically before the surgery, I've already performed it in my head with scenarios A, B, and C if things don't go well. When the surgery's over and completed, it's a good feeling to know that I provided her with the best care possible and that we were able to do it here locally without having to have her travel several hours to even get care that could be beneficial and taken care of here at home. I've just been so impressed by the character of physicians that we have here at the practice. They're really good people. They really care about their patients and desire the best, and they're very involved in the community through high schools and sports programs and through other activities throughout the community. That they really like to be involved, they like to know what's going on, and they really care about how the community is doing and really want to help, which I feel is really important. I want to be that kind of a doctor too.